So one of the first things is communication, right? And there are so many different ways of communicating. So we understand that communication, is important just for us, right? And so if you're in a time where it's saying social distancing, stay away from each other, that can be scary because we think, wait, who am I supposed to talk to? What am I supposed to do? But no, what we want you to do is we want to make sure that you understand communicating is absolutely a great thing to do. So, so you want to keep in touch with people. You want to communicate virtually. You want to communicate via telephone. Maybe go back to writing letters and postcards. I mean, hey, some new things that we can start doing are some things that we can go back to, but making sure that we keep those lines of communication open. The other thing about communication is, especially for those of us with children or who are in dependent care situations, we need to keep those lines of communication open too. Children will probably have a lot of questions around this time. I mean, they're not in school or they're having to take breaks from certain things. Things are different. Stay open and keep those lines of communication open with your kids. Talk to them. When they ask you questions, be honest. Another thing that I like to promote and that we like to promote as an agency and as a department is supporting each other and connectedness, right? And a big piece of that comes with self-care. So self-care, we understand that it's necessary that we care for ourselves. And it's important, especially during this time, especially when we're caring for others. We have to make sure that we're well and that we support each other, but also support ourselves first. One thing I like to do is tell people, support yourself first, and people are like, what does that mean? Well, an example is, no, we can't go out and get massages right now, but you can do a home pedicure. You can do a manicure. You can wash your hair. You can do a face mask. Anything that makes you feel better, even if it's just sitting outside for 10 minutes by yourself, uninterrupted. Those things that help to keep you grounded are very, very important. So we have a lot of resources that are available. So the first one, our Keep Calm Through COVID. Talked about that a little bit. You can call that 24 hours, 7 days a week, 365 days right now as it stands. It's totally confidential, it is free, and it's toll free. That is 1-866-310-7977. Give that line a call. It is specifically for those who are experiencing emotionally distressing thoughts and feelings due to COVID, but also anything else that you might need to talk about in terms of your emotional health and well-being. The next thing I want to talk about is our new recovery warm line that LDH has set up. Yep, we have another one for you too. This line is actually to help prevent a crisis. So before a crisis even occurs, you can call this line 24 hours a day, 7 days a week for free and get some assistance to help to manage how you're feeling and how you're doing. So that number is 1-833-333-1132. Next thing, visit our website at ldh.la.gov. Lots of resources, lots of information, all the way from the coronavirus statistics that one of our agencies has to specific topics about behavioral health that the Office of Behavioral Health has posted. ConquerCovid19.la. That is one that we also ask you to reach out and go and find out some information about it. Text REACH OUT in all caps, that is REACHOUT, to 741-741 to receive assistance and to help you through this difficult time. So the first thing is communication. I already mentioned that a little bit earlier, but stay in communication with people. The next is connectedness, making sure that we're staying connected with others, and also supporting ourselves. We've talked about that a little bit, but supporting others also. The next thing is safety, making sure that we're safe, not only physically safe, but emotionally safe. Limiting media intake. So I know that there are a lot of things out here that have a lot of information. It's all coming at us from all different angles. It's good to be informed, but we don't want to be overwhelmed with what's going on, right? So some experts say limit your media intake to about 2 to 3 times a day. Routine, making sure that we have solid routines. Typically we have routines. That's what structures our lives, right? And so now with things kind of being thrown off a little bit, we have to develop new routines. But that's also a good thing, right? Because in the wake of this COVID pandemic, we have our children with us at home. We have other family members maybe around too. So we get to develop some new things. And so being more innovative in how we manage family time, what types of crafts we do, also provides a solid little structure for the little ones to make sure that they're hanging on to also. And the last thing I want to talk about is overall health. So making sure we're eating right. I know people keep talking about leafy green vegetables and all of those things, but make sure you're getting your proteins like you need to, all of those things. Make sure you're getting your rest. People say 6 to 8 hours. I think that's a good idea. If you can, try it, right? But make sure you're getting restful sleep and that you're taking inventory of how well you're resting. Substances that a lot of people tend to use they actually have the reverse effect. So alcohol, for example, drinking alcohol, some people may use it to take the edge off, and that's cool. Not judging anybody, of course, but we need to be mindful of our intake because alcohol is a depressant. And so you need to make sure that we are being mindful of how we're using substances if we're using those, and especially for those who may be in recovery around us, helping to watch them so that we can help them to manage and support them through their time. Neighbors, reach out and stay well. That's what we're here for. So we ask you, reach out, stay well, stay connected,